Hello guys, what's up? Today is 1st of December 2022, and every 1st of December we celebrate what we call World AIDS Day. This year's theme says putting ourselves to test, achieving equity to end HIV. That is this year's theme. And today I want to use this little time to explain to you what we do on World AIDS Day. Also, I will just share more light on what HIV/AIDS is, the difference between HIV and AIDS, how someone can contact HIV virus through what means, the symptoms, okay, and some of the opportunistic infections, the prevention and the available treatment. Okay, so I want you to stay cool, don't go nowhere because I'll be going on a short break, and when I come back, I will take you down the road. So don't go nowhere, I'll be right back. Alright guys, welcome back. Like I told you before I went for a break that I'll be running a short presentation for you on what HIV/AIDS is, the difference between HIV and AIDS, how you can contact this virus, the symptoms and the opportunistic infection and the available treatment. So let's get started. Today is World AIDS Day, and it is celebrated every 1st of December. Alright, it's a day we come together to see how we can end HIV/AIDS virus, and also we use that day to remember those who have lost their life as a result of this illness. HIV simply means human immunodeficiency virus. It's a virus that attacks the immune system, okay, which is our body's natural ability to fight infection. The immune system is our body's natural ability to fight infection, and then what this virus does is it attacks the immune cell, a particular immune cell, and it duplicates itself inside this cell and moves to another cell. Okay, the name of this cell is called T helper cell. Another name for it is called CD4. All right, so this cell they helps your immune system to fight infection. All right, now that you know what HIV is, let's look at a brief history of HIV. Where does this HIV come from? According to research, HIV was first found in the blood sample of a man from Congo DR. Okay, it is said that the virus spread from chimpanzee to human sometime before 1931. Almost likely during the bushmeat trading, during the bushmeat hunting and trading. So some of these men, they come in contact with the blood of the animal. All right, so that was how this virus was able to spread from one person to another, because what they had contact with these chimpanzee animals that they are hunting and trading. Also, he said that before 1980, researchers estimate that about 100 to 300,000 people already were infected of HIV, and ever since then millions of people have lost their life as a result of this virus. So now we're going to look at the number of people that are currently living with this virus. Now, according to research, there were approximately 38.4 million people across the globe with HIV as of 2021. So out of this, 36.7 million people were adults, and then 1.7 million were children less than 15 years. Also, in addition, about 54% were women and girls, while the rest are male. And it also goes far to say, though the rate of new infection has decreased, okay, which is the essence of this awareness. The essence of creating this awareness is to see how we can reduce or we can end the transmission of this virus. The research was gotten from www.hiv.gov. You can go there and verify by yourself. So right now we are going to look at the stages involved in HIV. HIV involves about 3 stages. Okay, the first stage is the stage at which it is called acute HIV infection. At this stage is the very early stage when someone is newly infected with this virus. So at this stage, the virus is multiplying and replicating itself rapidly. So here are some of the symptoms that you are going to someone will experience when he or she is having this virus. And the symptoms include fever, body rashes, sore throats, swollen gland, headache, stomach upset, joint aches and pains, and also muscle pains. So like I told you, the second stage is the clinical stage. All right, and this clinical latency stage is a stage where that person have identified that he's having this virus and he or she has started medication. Now, one of the recommended treatments for people living with HIV is known as ART. ART simply means antiretroviral therapy. This is the second stage. But if you are adhering to your treatments, you are taking your regimen, okay, let's say you identified earlier that you're having this virus and you started treatment, your adherence to it, it will be very difficult for you to get to stage 3, which is the final stage, and it is called ACE. The third stage is called ACE. ACE meaning acquired immunodeficiency syndrome, which can take many years to develop. It will take many years to develop at this stage, especially when you are not adhering to your regimen or you are not responding to treatment. That is when this virus by then would have eaten up the immune cell, which is the CD4. It has eaten the CD4 too deep that it is now very weak to fight infection. And then when it is too weak, there are some of the opportunistic infection that you are going to be having, or maybe someone who is having this virus is going to be experiencing. So some of these opportunistic infection include pneumonia, tuberculosis, hepatitis, urinary tract infections, candidiasis, cancer, liver and kidney disease. And some of the symptoms at this stage may include weight loss, night sweats, fever, and persistent cough, mouth and skin problems, also regular infections. So now we are going to look at how can someone get this infection. Number one is having vaginal or anal unprotected sex with someone who already has this virus. And the second one is sharing of contaminated sharp objects, okay, which may include needle, syringes, maybe someone have needle and syringes for those who are into drugs, who are into drugs. And if you are sharing the same needle with someone who is infected, there's likely a chance that that person will also be infected. And the third one is receiving unsafe injection, blood transfusion, tissue transplant, and others. Then the fourth one is mother to child during pregnancy, childbirth, or even breastfeeding. So these are the 4 ways through which this virus can be transmitted from one person to another. Now, another thing that we're going to look at is what means can this virus be transmitted from one person to another. So some of the means include blood, semen, vaginal fluid, rectal fluid, and breast milk. So now that you've known the means through which this virus can be transmitted from one person to another, can we look at other means through which this virus cannot be transmitted? Okay, number one of them is what? Handshake. When you're having a handshake with someone who has this virus, or you are hugging this person, there's no way you can contact this virus through handshake or hugging. You cannot contact this virus through the air you breathe or the water you drink. You cannot also contact this virus through eating and drinking in the same place with someone who has this virus. You cannot contact this virus also through saliva or tears, or even sweat. Sharing a toilet with someone who has this virus, or using the same towel, or even lying on the same bed cannot transfer this virus to someone who doesn't have it. Also, mosquito bites or any other insect cannot transfer this virus from one person to another. So I've shared with you some of the ways this virus cannot be transferred from one person to another. So the next thing we should be looking at is how can this virus be diagnosed? HIV can be diagnosed through rapid diagnostic testing, of which you can get your results on the same day. Also, There are also this one. There is this self-kit test that you can use to test yourself. Okay, even at home, even if you don't want to visit any clinic center. But I prefer you visit any clinics or health center near you at least once in a year. Okay, at least once every year to check yourself and know your HIV status. That is what we call window period. This is a period whereby the body has not produced antibody so that it will indicate that such person has HIV virus. So now let's look at the treatment. What are the treatments for HIV infection? Like I told you earlier, we have one recommended treatment, which is ART, antiretroviral therapy. Once someone gets diagnosed of this virus, you can live as healthy, as happy as anybody, as long as you are adhering to your regimen that was recommended or that was prescribed to you by your healthcare practitioner, a doctor, or whoever it is that have recommended you to start taking your medication. Make sure you adhere to it, and I bet you're going to live healthy and happy. Okay, the only way it will get worse is if you are not adhering to your regimen. That is when it will get worse. So the recommended treatment for HIV virus, it was ART, antiretroviral therapy. So now this is the last stage, and this last stage is prevention. So how can we prevent HIV and AIDS? Number one is avoid unprotected sex. That is the first thing you must put to your head. Then two, know your HIV status. It is very important that you know your HIV status. At least visit any health center near you or hospital, or even go to any pharmacy. Ask them and tell them you want to know your HIV status. They are going to help you with that. Do it at least once every year. If you have done something that exposes you to something you think that exposes you to HIV, you can do that at least once in every 3 months. Okay, but then at least once a year. At all, once a year. So the next thing is, if someone has been indicated that this person have been tested and found to be HIV positive, adhere to your regimen. Adherence means take your regimen as at when you are supposed to take it. Make sure do everything possible not to miss your dose. Okay, it's very, very important. Also, lastly, this is for pregnant mothers. Okay, for pregnant mothers who have been diagnosed of HIV virus, they should do everything possible to take their medication to avoid transmitting this virus to the unborn child, either in their womb, during birth, or during breastfeeding. They should do everything possible to make sure that they take their medication. I want to thank you for taking our time to listen to this little presentation. All right, I hope you enjoyed it, or you've learned one or two things. If there's any question you have, or there's any observation, you can use the comment section. Okay, and if you're not following my page, Oramekus, you can do so both on Facebook, Instagram, YouTube. All right, make sure you follow me on all of these platforms so that you'll be notified each time I upload beautiful and educative content like this. Once again, goodbye, and then stay safe till I come your way again. Bye. Dear friend, thank you for watching this video. If you enjoyed this wonderful video, I need you to hit the like button, subscribe, and click the notification bell so you don't miss my subsequent videos. One more thing, go to the comment section, let me know your feel about this video, and finally share this video with whoever you think might find it interesting. Once again, thank you for watching. See you in my next video. Bye.